I'm Craig Duhon. I graduated from Texas A&M College of Medicine. I did my residency at Scott & White Clinic in Temple, Texas, where I received extensive training in total joint replacement, sports medicine, and the treatment of fractures. I've had an orthopedic practice in the Rockwall, Rowlett, and Garland areas for the past 24 years. I attend church in the Rockwall area and have been a team physician for one of the high schools in the area over the past 22 years. My philosophy is to treat patients with rehab, conservative treatment as much as possible, and use surgery as a last resort treatment. My overall philosophy is to treat patients as I would treat my own family, with patience and precision.
Hello, I'm Dr. Daniel Aldrich. I am a board-certified orthopedic surgeon with Lake Point Orthopedics here in Rockwall, Texas. I did my undergraduate training at the University of Notre Dame, did my residency in Cleveland at St. Luke's Medical Center, and then did a sports medicine fellowship in Aspen, Colorado at the Rocky Mountain Sports Medicine Fellowship. I've been here in the Rockwall area with Lake Point Orthopedics for 14 years. So I am generally a general orthopedic surgeon. We do take care of all different age groups, from children to the elderly and everything in between. And we take care of a variety of injuries, including fractures, joint replacements, sprains, strains. My primary focus is knee and shoulder surgery. That comprises a large portion of my practice. And I do both open and arthroscopic treatment of all types of knee and shoulder injuries, including joint replacements of the knee, shoulder, as well as the hip, and arthroscopic treatment of knee and shoulder disorders, including rotator cuff tears, meniscal injuries, and ACL tears. Our mission here at Lake Point Orthopedics is simple. We want to provide the highest quality possible care to our patients and do it here in a local setting, and return them to their pre-injury level of function as quickly as possible. We like to work with patients, understand what their goals are, what they want to achieve, what level of activity, what level of function they need to get back to. And we like to work with them from the initial visit all the way through the last visit to achieve success in their eyes. That's what's important, that the patient is happy. The patient is considering the success that what we have done for them has brought them back to where they want to be, whether that's a athletic endeavor, work endeavor, whatever their goals are. We work with them through non-surgical and surgical means, and with the addition of physical therapy when needed, to get them back to their... Being an orthopedic surgeon can be a very rewarding experience because of the large number of patients that we are able to really have a very significant impact on their lives. Most of our patients are motivated patients, or patients that are able to recover, that are going to get better. And so it's very rewarding to take someone who is in severe pain or who is severely disabled and to work with them through a variety of techniques, surgical and non-surgical techniques, to bring them to a level of function where they no longer have pain, where they can now live their life or participate in whatever activities they want to do without any pain, without any disability, without any limitation. It is so rewarding to see that, and we are lucky that we get to see that result with our patients every day.
Well, I kept having all this pain in my shoulder real bad. I couldn't sleep, and it was all down in my side and everything. So I come to Dr. Aldrich, Dr. Rubin, and they did some x-rays and things. So they told me I had to have a complete reversal. And so they did a complete reversal on my shoulder, and it's been well worth it. I had all of the therapy afterwards, and I'm doing great. Well, I was afraid that I wouldn't be able to use my arms and things like a normal, but I got all the good use out of my arms. I can do everything now that I did before, and I would recommend either one of them to do your surgery or whatever.
My name is Susan Nix. I'm 47 years old. I had a decompression of the distal clavicle. It's also called a shoulder scope. I had actually had surgery here years ago with Dr. Aldrich, and I don't remember how I probably just internet or. I was very pleased with my results after surgery. I was a lot better than I was before surgery. I was able to go back to a normal lifestyle. As a matter of fact, I could not do things that previously I could do. My shoulder had become so bad that I wasn't able to do a lot of things I needed to do. And after surgery, I am able to do everything a lot better. I would recommend Dr. Aldrich to anybody. I have actually recommended Dr. Aldrich to a lot of people. I tell everybody he's a great surgeon. After surgery, I have people say, I didn't even use pain medication. People are like, why did you not use your pain medication? I said, I didn't feel pain afterwards. I felt pain before surgery. After surgery, it was a little discomfort, but it was nothing like before.
Hello, my name is Brian Johnson, and I came to Dr. Tuhon because I tore my ACL playing sports, and we determined that he wasn't going to heal without surgery, so he performed the operation, and it went great. I never had a problem. I was, up and around the house later that day on crutches. I stayed on crutches for 6 weeks, but in that time I've been full recovery. I'm back to doing everything I normally do, and never had a problem, no pain. Yeah, everything about the experience was positive. I mean, I was surprised that there was no pain after the surgery, minimal scarring. I had no problems moving. I've had full range of motion since, even that day. And it went a lot better than I was told to expect or had expected on my own anyway. Yeah, I'd definitely come back. Hopefully I never have to come back, have another problem, but I'd refer them to anybody. I mean, everybody was surprised how quickly I'd jump back from knee surgery.
My name is Lacey Cheney. I'm 25 years old. I started going to Lake Point Orthopedic about 2 months ago for a hairline fracture that I had on my right foot. I had a bone graft done and also a screw put in my foot as well. So far, I would recommend anybody and everybody to go to this. I've been going, originally the first time I went to Lake Point Orthopedic was when I was about 20 years old on a shoulder fracture that I had. And how has it changed my life? I'm able to walk without pain. And I'm also able to go back to work with no problems as well. Dr. Aldrich was my doctor. He's a very nice man, and he took care of me right away. The moment I came in, the day I came in actually, for when I showed him my x-rays originally from my primary health physician, he wanted to go ahead the next day to go ahead and have surgery because I didn't realize how bad the fracture that I had in my foot, and he just took care of me like I was his own family.
Okay, my name is Glenn Daniel. The reason I decided to have surgery is because both legs hurt and I had to get around with crutches. And since I've had the surgery, I have 2 knee replacements, and I can walk now without pain. And I think I'd do it again if I had to, because this is as good a place as any to have it done.